I'm thrilled to be in the studio today with a special guest, Eva Panetta. I love it.
Thank you.
Great ring to it. We're going to talk about maybe the origin of your name here in just a minute. But you are the Director of Community Health Impact and Engagement
Yes, sir.
at the Michigan Health and Hospital Association, affectionately known as the MHA, as we call it here in the rural parts of Hillsdale County. And it's great to have you in the studio for your first time.
Absolutely.
We have an incredible series that we're launching. It's great to have you here to share a little bit of your insight and perspective. So, Eva, as we talk about some very sobering issues, we're going to get into it pretty heavy. And these are things that are not to be taken lightly.
Sure.
We're going to be addressing, community-based issues. But before we do that, we want somewhat of an understanding of your background.
Sure.
Because it's important for our listeners across the country to know we bring in some great experts, and you're one of them. You really are. The work that you've done, that I've had a chance as a board member to sit back and watch, the report outs from the work that you're doing, it's incredible. We get to read some of the success stories and reports, and that's presented to us by Mr. Peters. Very incredible, the work that you're doing. So why don't you give our listeners a little backdrop about, your background, education, and what you do at MHA in your specific role.
Fantastic. Well, thank you so much, first and foremost, for the opportunity. It is my honor to be here with you today. Since I have this opportunity, I also just wanted to thank you and everyone that's part of the rural health and your hospital.
Sure.
What you do matters every single day, and we'll talk about why that matters. So I have been with the Michigan Health and Hospital Association for over 14 years.
Wow.
And have served various roles within quality and patient safety space. So I'm not quite sure if you've had anyone from the MHA Keystone Center.
Oh, absolutely.
Yep, absolutely, right. So as you note, since it's 2003, I believe, right, with the kickoff of the intensive care unit project.
We actually started in 2003.
Incredible.
And we actually were right beside MHA. My predecessor, Duke Anderson, was on the board of MHA.
That's incredible.
And he was part of that process.
So the Keystone Center, right, as the quality and patient safety is absolutely one of those pioneering arms of our association.
It is.
And I often call it as that like best kept secret, unfortunately, because a lot of community people across our in Michigan don't know that it exists, and the impact it's had on healthcare and health has been instrumental, right? And so here we are in Michigan, shining stars, as I like to call them, right, coming together on a volunteer basis, right, to really drive improvement in quality and outcomes. And so the work exposed me to a lot of areas, so things like preventing falls and pressure ulcers, but one area in particular really kind of drove the direction of my current role within the readmissions area, right? So when we talk about readmissions and the work that we're trying to do, we're working to prevent people from to coming back to hospitals.
Yeah. Now, if I can interrupt you there.
Absolutely.
Did you start looking at that when we realized we were going to be penalized, or were you ahead of it before the penalty?
Correct. So that work was actually helped, supported through federal funding. Back in the day, it used to be called the Hospital Improvement Innovation Network.
Okay.
So through Medicaid Expansion Affordable Care Act, right, they helped establish these Hospital Improvement Innovation Networks, which were organizations, right, at the state level working with hospitals on a voluntary basis across 10 areas. They're called healthcare hospital-acquired conditions, like falls, pressure ulcers. And so we knew readmissions was an issue. Readmissions, the way it's being measured, is flawed. We all know that, right?
Yeah.
And the work that we were working on, through the clinical interventions and settings, really exposed me to how flawed that system in itself is, but also how much of an impact the socioeconomic conditions that we'll be talking about today have on these type of conditions and issues. We heard from nurses, from providers, from hospitals about patients coming back to hospitals, coming back to emergency rooms because they were socially isolated, because they were hungry, because they were dealing with homelessness, right? Or even those individuals that were there initially for clinical conditions like heart failures, coming back for non-clinical reasons because, guess what? I knew that if I come back and get admitted, I get a warm meal.
Oh, absolutely.
Right? Yeah. And so that really led the association to establish the first of its kind, my role, right, in helping look at that more ecosystem of health approach in the way that we deliver care that I think has been happening, right, in traditional healthcare models, but helping amplify it and really looking at it that whole health, whole person approach of the way that we deliver care to help improve, not only healthcare outcomes, but health.
So have you, so we're going to get into some of that, and I'm excited. So have you always, prior to this position at MHA, were you in healthcare anywhere else? Or you just jumped right in?
I unfortunately had no clinical healthcare experience, but this is where the connection lies. I actually worked in legislature.
You did?
I did. I worked for a representative working in urban areas, Plymouth, Northville area, who was the chairman of the Health Policy Committee. And so through that, of course...
Who was that, by the way?
Mark Corvo.
Okay.
He actually, now a huge advocate and a mentor of mine.
In a lobby, or he's a consultant, right?
That is correct, for Henry Ford.
Henry Ford,
He's had multiple hats. But through that work, of course, that exposed me to the Hospital Association, right?
Yeah.
And at that time, we use the Hospital Association and members like you to really give us the facts and the real truth when we were analyzing policies, right? And at that time, I learned about the Keystone work. And unfortunately, as you know, policy takes time. And there's a lot of challenges, and the impact of our ability to actually make change takes time. And so what drove me to the work of the MHA Keystone Center was that ability to really make an impact now.
Yeah.
And
so you kind of get to serve, because there's the advocacy side of MHA, but you probably bleed over a little bit into that sometimes, don't you?
Absolutely. We'll talk about that, right?
Yeah.
So I really see my new role as what I would call a bridge.
Yeah.
A bridge that's working to optimize existing functions of our members and our association, right? Because if you look at the areas that impact health, access, right, quality of care, care integration, those are all areas we've already been looking at. It's just really looking at a more, I would say, systematic way of doing it within the walls of the hospitals, and that's been my goal, is to really amplify those best practices and really learn how we operationalize them, and again shift that traditional medical care model to be more of holistic model.
Well, it's a great tee up to our conversation today, and I'm excited to have conversation about some of the work that's being done. Prior to doing that, though, we want to kind of humanize you a little bit. So for our listeners who may be listening in Texas and California, let them get to know you a little bit more. So do you have a fun fact?
I do.
Interesting fact about yourself that you'd like our listeners to know? Maybe it can be fun, it could just be interesting, or maybe just boring. I don't care.
Yeah.
But do you have something you'd like to share so we can humanize this conversation a little bit?
I love it, and it will actually provide a perspective of why I'm here today. So I like to say and joke that I am off the boat Polish immigrant.
Okay.
So, Nice. I actually immigrated to this beautiful country.
Oh, you did yourself?
I did.
Okay.
Absolutely, at age 10. I'm not going to tell how many years because that's going to give my age away.
It's only been 15 years ago, so that's awesome.
2 years ago, right? Didn't speak a lick of English.
Is that right?
Absolutely, yep. So my father was already here, and he was able to immigrate through that, legal green card working process. We came 10 years after, so we were in separation for 10 years. Had a local landscaping actually business, but both my parents had multiple chronic care conditions that exposed me at an early age. Now, mind you, 11 coming, no language, to what I would say very complicated healthcare system, right? So complicated for you as provider, but complicated for the patient. And it really exposed me to some of, I would say, opportunities, right, in how we provide care to diverse patient populations, right, from different economic backgrounds. We were lucky enough financially, we were very well off, and we also had the access issues. But if you don't have the, what I would say, supportive entities like translators to help understand how, your healthcare, I served as that. And so at an early age, I was really exposed to those gaps, and it's really grew my passion to help advocate.
That's incredible. Let me ask another question, follow up to that. So we hear these stories about the boat. I came over. Yeah. So, I mean, come on. Is it like that? Or is it like a Carnival cruise, or what is it?
I love it.
So give us some insight here.
And I joke and I use that to kind of to know that I am actually like an immigrant, but no, I actually flew on a plane.
Flew on a plane,
right?
okay.
But believe it or not, there's some people
There
that
are
really
some.
do believe that there's still that.
There are some, right? They
Immigration
believe
through
literally
boats.
it's like this wooden boat that's
Correct.
Yeah, all right. Just wanted to clarify that.
Yep,
You
no.
weren't out there rowing a boat.
Unfortunately, no. I
So
was
the
comfortably
pathway
sit-
was,
Yep.
the pathway legally, and
Absolutely.
And since then, you've done remarkably well
Thank you.
as a champion and an advocate for rural health. I thank God that you came to America to do that,
well,
because we
thank
need
you.
more voices. So we're going to talk about
Yep.
that passion that obviously started at a young age,
Absolutely.
watching your parents. That's really a lot of times where our passions
Yes.
grow out of personal circumstances, right? And so, you've had a chance to work with many, many hospitals,
Right.
and today we're going to talk about, rural health safety nets,
Yes.
and they are critically important, and what it takes to provide access to healthcare in what we describe and what we see every day as underserved communities.
Correct.
These are communities that don't have access to OB at times. That's failing right now
Incredibly
at exponential rates.
Absolutely.
Access to even primary care is limited, or it's months out. Specialty care years out if they can get it. So I'm excited that you're going to be here today to share your perspective on how rural health has been fractured by a lack of resources and adequate reimbursement to hospitals. That's where my passion is, because we have to start talking about that.
Absolutely.
And we'll talk also about what's happening to our rural populations, the role hospitals have in their communities, and what all of this has to do with rural health. So let's set the stage.
Yep.
Let's first start with the big picture.
Right.
So what is happening? Let's talk about the big picture of healthcare. Why, from your perspective, having studied it now for nearly 2 decades, why is our nation's population health deteriorating?
Sure.
What's going on?
That's a loaded question.
It
huh?
is.
Where do we start?
It is.
And I think some of the issues, you've already covered through, the podcast series and some of the great interviews that you've done. What I would like to say, and I'll boil down to 3 main factors that are very much interconnected, right? So first, let's talk about that healthcare systematic challenges, those financial strains that you talk about, right?
Yeah, every day.
Every single day, right? So, and those are experienced everywhere, even by urban hospitals, right? Like workforce shortages, right? Reimbursement, like you said, access to healthcare and preventative services, right? So those are what I would call healthcare system challenges and systemic issues that unfortunately I feel like are getting worse. Right?
Absolutely.
Then you have the population trend issues, right? Again, all areas that you've covered, right? Like the aging populations with that, right? So we're living longer.
We're seeing it. Yeah.
But there's
Absolutely.
a lot more complex care
There is.
issues, right?
There is.
That you're dealing with. And then you layer it with what we know, right, through research, impacts 80% of our health. And those are those social and economic factors, right? So this is places you live, work, and play, right? The access to jobs, access to housing, safe housing, right?
Safe housing.
And I would like to also say those conditions are deteriorating, right?
Sure they are.
Families are struggling to pay bills. Families are struggling
Daily.
to afford access to healthy foods,
That's right.
right? We have senior citizens who are living on fixed incomes. Yes, their house may be paid for, but they're choosing between paying their electrical bills or, eating a healthy meal.
Absolutely.
Or going to see primary care for
Correct.
issues that they're dealing with. So
Or going to the food pantries to get sugar, cereals, and Pop-Tarts.
exactly.
That's another passion
Right.
that we have to fix some of that. But
Amen
anyway,
to that.
but here they are struggling day by day to even make it.
Absolutely.
And generationally, we're seeing a gap there as well, that families are not rising up to take care of
They're not.
families.
Right. And people, if you think about those generational cultural issues, they're also not asking for the help because it's a
They're not.
prideful
It's a
thing.
pride. It's a pride
They're
issue.
waiting until the last
Absolutely.
minute. And so if you're taking all those factors that we mentioned, right, the systemic healthcare issues, the population trend changes, the social economic conditions, now you talk about removing access, right? Where do people end up?
Take a guess.
Your hospitals.
My ER.
Exactly.
That's the first gateway. Yep.
Absolutely, right? So you mentioned that word safety net. That is the safety net, right? It's been happening for years now. What I would say, that transition and evolution of hospitals from those traditional medical care models that, that's what we know hospitals to be.
Mm-hmm.
Well, guess what? They're not just dealing with medical conditions. They're dealing with all of those
Social.
factors,
Absolutely.
the 80%. And so when we remove access, right, it doesn't just impact hospitals and people. Those access points impact all the other 80% that impact health, right? Those ability for people to get identified because hospitals are screening for social needs like
absolutely.
food, right? And so that has been my biggest passion, is really making sure that we understand the role of the hospitals in its totality and how those roles and those institutions drive health.
And you've done a remarkable job at that, MHA. And I'd encourage any of my friends. The good news is Michigan has 100% participation of all hospitals.
Yes.
So if you're listening across the country and you are in a state that has an association, all of them do, and you're not part of it, I would encourage you, link up with your state associations, because you'll get this type and this level of support from your association. Now, I would submit to say that MHA is the best in the industry, because I believe that. I really do. We've interviewed a lot of hospital associations on our tour, and I really have to submit that we are the best. I mean, it's an incredible program. But 15 years ago, I was in Chicago, and my predecessor was speaking at a conference that I attended, and I heard for the very first time, Randy DeGroot was his name. He was the CEO of ProMedica Hospitals. He's up on stage, and he uses these words: social determinants of health. And I'm like, I just come out of county government. I've got 1 year under my belt here. I'm like, I think I know everything, and of course, not knowing anything, I Google it, and there's not much information about it. So it's just coming out, right?
Sure.
And so through the years, we've learned the relationship that social issues and factors play on wellness, health, recovery. And it's so critically important when individuals don't have the nutrition. We argue across this country about cutting SNAP and food stamps, and those people need to work. Those people are working. The majority of those people do work. We grew up in a home where we use food stamps. And if it would not have been for those food stamps, we wouldn't have survived. It was the nutrition we needed. I also know what the hunger pains feel like living between very small amounts of food stamps among 7 children and 2 parents, of going to school hungry and not being able to focus on schoolwork. And so I learned quickly what social determinants of health truly means. Now, today, we're asking in clinics on your annual wellness visit. What are we asking? What types of questions?
So, well, first and foremost, thank you for sharing that, because I think we have to start humanizing the reality of conditions and people, the challenges that they face. So this, talking about that evolution, hospitals are working to implement what I would call those operational infrastructure strategies that help identify those needs through screening.
They do,
right?
Screenings.
Right? So think about it, right? You remember filling out paperwork, which you unfortunately have to do, seeing those type of questions, right? That assess access to health, right? Healthy foods, housing, stable housing, transportation, right? So that's just one of those ways that we're seeing that evolution of hospitals' role, right?
So, you go to your primary care appointment, it's your annual visit, and you're answering a questionnaire that says, do you have access to food? Have you been able to pay your rent? Do you have electricity? We weren't asking those questions 15 years ago.
Correct.
And I'm so glad we are today because we're finding those gaps.
We are.
Now, my question to you is, as we identify those gaps, what are we doing about it?
So that's a great question. And I think there's even an opportunity within that identification of those gaps, like the screening, that I want to talk about as well first before we talk about the how are we working to address. I think communities are not used to hospitals asking those questions. And so, right? And I'm sure you're seeing this, right?
And and let's not forget, community members sometimes don't like to answer those questions.
Exactly.
We need to address that at some level
Absolutely,
as well.
Right? So I think, the work that we're helping support and through my function is really looking at what does it look like to be more effective in assessing those needs, right? to me, that boils down to making sure we're communicating, again, back to the advocacy with our community, why we're asking those questions, humanizing those stories, and connecting it to the next part, which is that we can serve as a critical bridge to help refer or address current needs, right? So that's that referral piece. But, as you know, those challenges there, right? Because even though we may be collecting this data, there's other entities in our communities that are also connecting the data. But how do we talk to each other so that there is that care continuum that we talk about in healthcare all the time?
All the time.
Right? So that, maybe it's going to take 3 times asking, Joe Smith, who's, again, senior citizen and comes from a culture that's very prideful, so that by the 3rd time he feels comfortable.
Absolutely.
Sharing those questions, right?
So what I recall growing up is my mom always had us in church every Sunday.
Yeah.
Every Wednesday night and every Sunday night. And Sunday night, Kirsten was the gospel sing, and it was talking to my producer now, and it was a time in which we would have, just a fun time.
Yeah.
And it was important to socialize, right?
Sure.
But I remember one Sunday very, very distinctly. It was church gets out. Sun hasn't set yet. We were hungry. Kids get in the back of the car. There was no safety belts in. We're loaded up on the window. And I remember a lady at the church brought out a basket of food. And we probably hadn't eaten for a couple of days and had brought a basket of food. And my mother was so proud, she wouldn't accept it.
I'm sure.
And we were hungry.
Yes.
And I remember leaving there, and looking in the back of the window, true story, yearning for that food and just thinking, I didn't understand it then, the pride. I didn't understand those type of things. But that's the stuff we have to cut through. And I think we in health systems have done a good job.
Sure.
But there's a lot more room for improvement in that area because we are executives and nurses.
Sure.
Like, nurses are 6 figures and all these folks are making really good salary. And we sometimes forget about the patient that comes through that door, doesn't know where that next meal's coming from. And we have a lot of food waste and we do those things. I want our listeners to understand the critical nature of social determinants of health and recognizing that, potentially saving a life when that patient checks into the hospital.
Absolutely.
You have resources for them. That's very important. I know that's heavy, but at the end of the day, I think we use those life experiences to tell a story.
Absolutely.
And telling that story is important so we don't make the mistakes of the past.
Absolutely.
That we understand that pride will sometimes step in our way to ask for help, but there's so much of a need out there. But there's also a lot of community support groups, right?
Sure.
That can offer that. So let's transition here just a little bit. So we have these social and economic issues that hospitals are facing right now. I want to ask you, how are you seeing in your role successful hospitals who are navigating that? How are they meeting the needs of those patients? How would you identify a successful program that's meeting those needs?
Absolutely. I think it boils down to 3 things I like to call, and not to simplify this because this work is complicated and everything you have said is not an easy task,
it isn't.
Right? I boil it down to awareness, adoption, alliances, and advocacy. So not 3, 4.
Nice.
The 4 A's I like to call them. Awareness is those exact things that we just talked about, really being systematic in the way that we work to address needs. So through screening, right, we have, of course, community health needs assessments, right,
Correct.
which are another great tool that provide another deeper dive evaluation, but should not be the only tool, right?
It's one of many.
To analyze need, but also I understand, are the existing infrastructures and the programs actually meeting those needs, right? So that's that systematic screening for social drivers of health. Third, adoption. So, the healthcare world was not set up to, operationalize and develop interventions that are that move beyond medical conditions. So adoption.
Because it just stops, right? I mean,
absolutely.
That's just our job. It stops right there.
I was just going to say, I'm sure you've been told, stay in your lane
many
times, right?
Many times.
Unfortunately.
Twice today by Kirsten. Yes.
Correct.
Stay in your lane.
That's never been really what we've done.
Right.
We don't talk about it.
No, we don't.
But we don't.
Right.
So again, shifting those operational, clinical medical models to be more comprehensive, that requires staff education and awareness and humanizing those things that you talked about,
Absolutely.
right? The other thing I really want to talk about in terms of the awareness is it's really difficult for staff screening patients on needs they themselves have, right? So
Right.
so from the hospital perspective, how are you making those needs not just a community need, but your own house needs,
Yeah.
right? You have members of your staff that are probably dealing with the same issues that they may be asking the patients about. So starting within the walls of your hospitals are one of those key strategies. Alliances, I like to use alliances, not partnerships, for the reason that I think we've talked about collaborations and partnerships, but alliances mean aligning in our strategic investments, right? So it may be the community benefit, right? Let's all pull together our dollars, right? And really look at addressing root causes that we talked about, those economic conditions, right? And being more collaborative and aligning our strategies in addressing those causes so that we can be more impactful around those areas. So think about pipelines, right, which are a critical part of helping identify those disadvantaged populations and providing them with the education, the background, and health and economic, job opportunities that they may not be aware of. So again, and investments in housing. I've seen hospitals,
I know.
invest even in housing issues, which are so critical.
Yeah, they are.
So those are some areas.
Transportation issues.
Absolutely, right?
Yeah.
And to me, advocacy. And I want to go back to that comment I made earlier about this is not the time to stay silent, right? And so it's really important that we use that data that we talked about, the social drivers of health, and use it as an advocacy tool to push back on the broken systems that we are now taking, again, as a safety net, and hospitals are those, I would say the brunt of it, right? And helping advocate to identify where those gaps are so that systematic policy changes are made that can help make doing the things we want to do, but are so challenging to do. So
Absolutely.
so those are the four areas. But I mean, there's so many great examples through food pantries, to again, all those things that I mentioned that hospitals are investing in through partnerships in really making and tackling root causes.
Yeah, one of the most brilliant minds in healthcare, Brian Peters, who I credit as incredible, often says to us at our board meetings that this is not a spectator sport.
It is not.
And I got to tell you, a lot of hospitals have been on the sidelines. A lot of hospitals have been up in the cheering section, but they haven't been on the field. And we've got to change that, because if we're going to make a difference in 100%. Our communities, we got to be a voice. We have to get out there, arm in arm. We've remained silent too long.
Absolutely.
Now we switch that to rural hospitals, who even have more of a challenge. And I'm going to tell you that the challenges have never been more serious for us.
Absolutely.
The cuts to Medicaid under the one big beautiful bill, which will strip the provider tax, all the challenges that we face with the government trying to shut down 340B programs, nurse staffing ratios, you name it, we're under assault. Rural communities specifically. It's hard to recruit. Cost of living might be better, but unfortunately, the opportunities for individuals to have entertainment and enlightenment and all those great things, people don't naturally flock to rural communities to get their jobs. So you have a recruitment issue. You have a retention issue at times when competitor hospitals are offering $30,000 sign-on bonuses that rural hospitals can't. All these complexities, all these challenges. But I want to go back to some roots of problems, okay? So I'm going to ask you this question. Why are rural communities so vulnerable to reimbursement changes and other policies that are impacting us today? Let's say that in the context of rural versus urban.
Yeah.
And I know we sometimes don't like to do that because we want to lump us all together, but we're not. Rural communities are much different than urban communities. So could you give us some insight into that? What's the vulnerability of reimbursement?
Yeah, and I think what I like to say is, though within healthcare and hospitals sectors, we all kind of feel the pains of everything we've talked about. rural communities, like you've already mentioned, really, truly, those issues are just amplified,
They
right?
are.
So again, the demographics, right? Rural communities typically represent an older generation that unfortunately bear the more serious clinical and medical conditions, right? Those comorbidity issues that we talk about, the complexity of cares. But also on that side, deal with access to critical preventive care services, right? Because of distance and all the things that you talked about, right? So, like, let's take, for example, telehealth, right? I love it. Great strategy, right? And as an innovative approach for rural hospitals, it's a critically important tool. But if you don't have the internet bandwidth and access to, then how is that a tool?
It's not a tool.
Right? It's not.
Yeah.
And so I love it, right? But I think from the, like, even the rural transformation funds, right? Like,
Don't get
that's
me
a
started.
key area.
Don't get me started.
Well, great. But what are you going to do about it to make that an effective
Absolutely.
tool? And so, so that, right? Demographic population, the financial fragility that you talked about, right? Like, you are dealing with small numbers, right? Those people matter.
They do.
Those are not numbers. Those are people, right? But your ability to adjust financial gaps when you have constant
small, thin margins.
Where do you go?
Where do you go?
So on top of providing those medical preventative care services that we talked about, how do you then, on top of that, layer those services and those socioeconomic support services that we talked about? How do you do that, right? And the workforce issue is a perfect example, right? That is a huge issue that's rising the cost. And so we talk about the rising cost, right? And you have adversaries that keep saying, well, it's the hospital's fault.
Oh, yeah,
Well, think about it,
right?
right?
Sure it is. Yeah.
You know, you have an entity, unlike other industry, and this is the other frustrating part that actually for a long time healthcare liked to be compared to other industries. There's
nothing to compare it to.
You're a social worker. You're a behavioral health expert. You're a medical care
You're
provider.
a financial analyst.
You're a financial analyst. And in a rural setting, you're probably the individual that knows every person that comes to the wall.
Absolutely.
Right? And so those are the realities. And I think this is the point of the critical role of advocacy, right? We can't just collect those stories. We have to humanize the data. We have to push and fight and share those stories to really provide that true and honest perspective.
Absolutely. It's so critically important. So, okay, I'm a rural hospital listening today. What is the role that our hospital should play in community health in general?
Yep.
What do you see as that? But then what key strategies should hospital leaders be focusing on to prioritize access for their patients? Because there's a lot of competing interest.
There is.
Centering now, right? That's huge. But we're in a rural community where 72% of my payer mix is Medicaid, Medicare.
Right.
80% of my payers in OB programs is Medicaid.
Right.
We're living on no margin, not even razor thin. There's no margin. And our challenges in rural America are so much different than even my counterparts in urban areas just up the road who have unlimited access to cash, right? We don't have that. We don't have the negotiating power with Blue Cross because we don't have the volume to go in and say you're going to give us, 190% of Medicare. We don't get that opportunity. We get what is given to us. Now, we have a great CFO who negotiates amazingly, but at the end of the day, rural health is limited to what type of reimbursement we get.
Sure.
But we're impacted because the government regulates so much of this because they are the payers for us. So issues of advocacy do play a significant role, or the lack thereof, and not advocating for rural hospitals to get their fair share. We'll talk about that in future episodes, but understanding what strategies hospital leaders, so someone's listening to that may not even be in Michigan. What things can they do today to focus on how to prioritize access to healthcare in those rural communities? Not saying that the solution is selling your hospital to a big system. We don't believe in that. We believe that rural communities can still have independent, autonomous hospitals who can serve their community and they know what's best for them to keep care local. What are the priorities that they can launch?
Yeah, so I would like to say focus on seeing the community as a patient, right? I think oftentimes, we look at from the hospital perspective, providing the best care at an individual level versus like shifting our models to be more to that population level, right? So, but those take time, right? So everything we talked about, like the screening, assessment, the referral, right? The investments and aligning what we call those anchor mission strategies to align with community health needs are long-term strategies, but fight. Tell your story like you're doing here today and you've been doing through the podcast and those channels. Humanize the data because I read an article that talked about if small data, the problem within healthcare about small numbers, right? And if you don't show up on a dashboard, right? If you don't show up on those, data points that we all care about, and it's the way that we measure healthcare, then you cease to exist, right? So to me, it's about leveraging and collecting those stories, right? To making sure that people understand the reality of what you do and what you provide and the impact you play within your community.
Why do you think our community has been silent?
I think, I have a lot of thoughts.
Well, you've worked with it.
Honestly, I think about it. We're a safety net. We like to just say, yes, we'll take care of it, right? We'll figure it out because rural America is the bedrock of America, right? And they've been dealing with these challenges for years to come, right? And they've just found ways to kind of, to manage it and deal with it. And I think that the time has now come to speak louder. And I think there's also a lot of misinformation and misunderstanding. So like the Medicaid and Medicare coverage, right? I mean, we talk about facts mattering. Yeah. Oftentimes we need to put them in a way that's understandable.
Well, it's easy just to say fraud, waste, and abuse, and everybody can coalesce around it, right?
Absolutely.
Like, who wants waste, fraud, and abuse?
Absolutely.
No one does.
Nope.
But what does that represent truly? What percentage of waste, fraud, and abuse exists in that whole system? Minuscule compared to the people and the lives that it impacts
absolutely.
And helps the most. But we get hung up on some of that. That's very dangerous.
It is very dangerous. And, you mentioned a little while ago about the buzzword of social drivers of health. And at that time, were you already in the hospital setting?
I had just come in.
Okay. But what I would like to say from the rural perspective, I remember when I worked in with the critical access hospital space in that Keystone Quality and Patient Safety. This is 10 years ago, before the social drivers of health buzzword became. I heard about the things that your hospital, like rural hospitals, were doing, like lifting up dental clinics for children that didn't have dental access that were dealing with massive pain.
Yeah, we did it.
You were doing it.
We did it.
You just didn't have a word to describe it.
You're right.
Right?
We brought it here.
You brought it.
We got it right down the road.
Amen, right?
Yeah.
And so, but we didn't talk about it.
We didn't know what it was.
We
didn't call it that.
100%. And we didn't know how to measure it. Now we know. We do. Right? And we're going to.
We do.
So use that. To really amplify the message of everything that you do and the lives that you touch.
Yeah. So let me ask, we're almost done. I mean, we have used so much time, but it's been incredible to learn your perspective in the work that MHA is doing. Let's talk a little bit about that because you're closing out a calendar year.
Yes, we are.
And you're getting ready to enter a new calendar year. What are you working on that's exciting to you? What do you look forward the most to in the next year of being able to say, you know what? We did well because we were able to do X. What type of projects?
Well, thank you for the opportunity. And this is a perfect segue for me to give your hospital and your staff kudos because your staff member, Kirsten, is actually part of those efforts.
Yeah, it's incredible, isn't it?
I talked about, hospitals have been doing it, right? But it's more about operationalizing it and systemizing it and spreading it. And so we are actually working through member-driven work groups, and I call them think tanks across the areas that we covered, all of the areas, right? Access, care integration, quality patient safety, so quality improvement, and patient experience and community alliance. And our idea is to actually leverage the Keystone model, right, to identify what are those, what I would say, best practices. And what does it look like from a more reliable implementation? Like, how do we implement them concerning all of the challenges that we just talked about to really squeeze as much juice as we possibly can in being effective in deploying those strategies, right? So, again, going back to that social drivers of health screening, right? So rather than first deploying that screening, making sure that we have communication to our communities, why we're asking those questions, to provide that awareness, right? It's educating staff on how to effectively ask those questions. I can tell you I've gone through a process where staff are asking patients during their emergency room visit intake, traditional questions like, what's your insurance, what's your address, and then being like, and do you need food? Those are, how do we make those transitions more understandable?
Seamless and
seamless,
right? Makes sense.
So those are the areas. And so those 4 think tank work groups are helping us really identify what those strategies are and offer recommendations of how we effectively operationalize them. Advocacy is going to be a key thread. We have to keep advocating for those changes. But like even in healthcare coverage, right? Like what operational things can hospitals do to protect members to stay covered, right? So thinking about identifying navigators, emergency rooms that can help people and identify them not only for coverage, but also helping them through that bureaucratic application process. And recertification, right? So those are all things that we're looking at identifying and leveraging the strength of the association. I think you mentioned it, right? What makes Michigan stand out and the healthcare partners and our association is that these are areas that we know we are not competing on, right? That we are willing to band together, to work together, to share those best practices. And rural hospitals are perfect at that, right? We have networks that already provide that ability to share and collaborate. So come together. Don't recreate the wheel. Leverage what other people are doing and identify, are those approaches, something that you can take on and implement within your hospitals. That network of, community partners within the healthcare settings is critical.
I want you to put your hat on that you wore 15 years ago.
Yes.
How do we leverage politicians to get involved in this process?
Have them come and visit and shadow your staff, not just your role, right? Those frontline providers.
Right.
Have them sit in your emergency rooms, right? Or in your primary care entities talking to patients. Like, those are the type of things I think will expose it. And it's, again, to me, humanizing, right? So collecting the stories that we talked about so that we're not just sharing numbers, because I think, people's lives get lost in the numbers. Those are critical ways.
Because legislation can be manufactured in such a manner to help hospitals achieve these goals.
Correct.
If the legislators are empowered to make decisions based on what the needs of their community members are.
Correct.
And we have to showcase the poverty, the care gaps. Those are so critically important, but we just kind of remain silent about it. We just do our work.
Yes, we do.
We just, we go about it. But if there's one thing I think our listeners could learn today, it's lift your voice.
Lift your voice.
Right?
Yeah.
Lift your voice.
Absolutely. And, share all the things that you mentioned, but also find a way to help articulate the complexity of those healthcare systems. I mean, think about it. You have legislators that have no clinical background or experience, right? And we're asking them to understand very complex issues. But at the same time, I think take the most recent state budget process, the ability for us to do that was cut out, right?
Sure was.
There were decisions made by legislators, right? And I'm not trying to call anybody out.
You're allowed to.
That without any data and understanding.
None.
Right?
Talking points.
Correct.
But it's what we're seeing on the national level that
Absolutely.
we just witnessed here at the state level.
Exactly.
You use cliche words.
Exactly.
You throw and scare panic to the public that, this is all because of fraud, waste, and abuse, and the system's terrible. Hospitals are overcharging. What are we hearing right now? Just this week, published by the Speaker of the House. Hospitals are overcharging. We're going to create a task force and have legislation.
Correct.
And controlling prices for hospitals. Really? I
So,
think we've looked at that a few times, the dangerousness of that.
Again, think about the investment of looking at not the root cause of the issue. Do you think we're going to get better at that? I mean, this is what's, I think, frustrating, right?
Very frustrating.
It's a complicated. And I think from my perspective, and this is something that actually was brought up during the legislative advocacy day that we had a few months before, actually during the time of the budget.
Yeah.
Rather than maybe talk separately, convening these legislative panels and those rural leaders in a room and really looking at the big picture.
Yeah.
Right? Maybe there's an opportunity, and I
think there is.
From a, so that way you're not just advocating within your public policy member, but that we're looking at it so that these legislators can come together and bandwidth and say, wow, like we didn't know this.
Right.
And then at that same time, unfortunately, because politics are politics, provide that ability for them to come together and help advocate for their communities in a better way.
Well, we'll stay away from politics for the rest of this conversation. Yes. Politics, by the way, as a Latin minor, poly meaning many, ticks, blood-sucking leeches, politics. Okay, anyway, so let's focus on something a little more positive.
All right.
That'll probably be cut from this podcast, by the way. So let's focus on something a little more positive. You are inspirational. Your personal journey alone, but also what you've done professionally to elevate this awareness in rural communities and communities throughout Michigan, not just rural, but in healthcare communities throughout Michigan. So your wisdom is important. And we do this on every one of our podcasts as a closing segment. It is called Rural Health Recommendations. Mm-hmm. For every guest that we have on, we want a glimpse inside the success that you've had. We want you to share that, a piece of it, with a listener today. Someone may be listening today in another state far, far away who is struggling with communication, with relationships with legislators and hospital CEOs, whatever it is.
Sure.
What advice, what piece, what one thing, sage advice, life advice of a new young leader maybe aspiring to make a difference that you've just talked about? How do you transform communities, positive healthcare outcomes? What is that one piece of advice? What would you give to someone listening today? What's that recommendation?
That's another heavy question, right?
It's a heavy one.
And I think, we've covered very heavy topics and real topics that, again, make it, I think, difficult to do the right things, right?
It is.
But I will say this. Take the time to pause and reflect about what you do. So, again, to those that are within the health and healthcare systems, don't ever forget to reflect on the impact, right? So throughout healthcare, we have the opportunities to really connect and change lives. And we do change lives every day. Use those opportunities to collect the voices of the unheard, right? Those stories that humanize the data that we have. And not only use those reflections to continue driving your purpose, right, when the challenges keep mounting, but use them as that advocacy channel, right? Our medical professional in our association likes to always say, everybody's destination is healthcare, right? The things that you and I are working on isn't just for others, it's for us. You talked about your challenges growing up, right? There are people that are now experiencing those challenges. So to me, that pause and reflecting about the true purpose is really critical, and using those reflections, collecting those stories and using them as an advocacy tool to help advocate for the real, challenges that communities in rural America face.
Yeah. Great advice. If we could just pause, reflect, and do it, we just get so surrounded by all types of interactions and interruptions and distractions that we just have to stop. And I think that's some sage advice that you've given. So thank you. Thanks for joining us today.
Oh, it's my pleasure.
It's been great to have you on the podcast, and we hope to have you back again to talk about some of the exciting things that MHA is engaged in.
I would love to come back.
And we would just love to be able to learn a little bit more about some of those initiatives that are going to be launched. I know we have a new strategic plan year.
Yes,
that's headed our way, and so it's always exciting to gather at the MHA conference and learn about what we're going to try to tackle in the next program year. Great leadership at MHA.
Yes,
we
absolutely.
think about not only from the leadership side of the MHA proper, but also the board. What Bill Manns, our chairman, is able to accomplish, and we sit around a table as maybe sometimes competitors, as friendly as we are, but we come and we coalesce around one simple understanding: love on our patients, care for our patients, give the best patient care that we can. All the other stuff is noise.
Absolutely.
But when we get down to that fact, we can make a lot of friends. A lot of the distractions are removed when we focus on the patient. So lifting our voice. Thank you for that message today.
Absolutely.
It's very important. And we hope that you come back to join us in future episodes.
I would love to, yes. And thank you all again having this opportunity. I just wanted to, to send a message to everybody within the rural health space. Thank you for what you do. Don't give up, right? You impact lives every single day. That fight needs to continue. Amplify it. So thank you. Don't give up. I think within challenges are opportunities. So let's use this as an opportunity.
Well, thank you. And thanks to our listeners for tuning into Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you're subscribed so you never miss an episode. Until next time, remember the power of rural.